So good afternoon, everyone. I'm Josh Stubbs, and I'm the Director of Integrated Services here at Harrington Family Health Center. And as many of you know, Harrington Family Health Center provides comprehensive medical and behavioral health, podiatry, and dental services to our patients and community members. Part of our job here is to provide best quality of care to our patients, and as well as educate our patients on the cost of their care and what their plan covers for them. And this is why Kara has joined us today. Kara Oland is the Outreach and Education Specialist from Community Health Option.
Sandy, pick up line 2.
And she
Sandy,
will
pick
be
up line
here
2,
to
please.
give us a presentation to help you understand your insurance policies. So, Kara.
Thank you, thank you. And thank you to Harrington Family Health Center. I really appreciate you inviting me to come and speak to everyone. Welcome.
Thank you.
I have to read my notes. What I do for community health, I should just let you know, is I manage, or I don't manage, I work for our Outreach and Education Department. What I do is go out into the community, talk to people about our company, but I also, part of my job is to help people to understand how best to use their plan, how to understand insurance. With any insurance company, there are some very basic terms that people need to know to be able to use their health insurance. So that's part of the job that I do. Using your insurance wisely can help you to save money. And this is it. What do you need to know to protect your physical and financial well-being? And how can insurance help you do that? Oh, thank you. I'm trying to go forward here. Oh, thanks. So all insurance companies, hospitals, health centers, all of us, it's a team effort with you. We want it to make it easier for you to understand your health insurance plan, what it covers and how it works. And it, makes the whole system work for everyone. It's complicated. And we all know how complicated it can be. So I will do my best to cover the following topics. Explaining the basics, copay, deductible, co-insurance, maximum out-of-pocket, and other important terms. I'll review ways that you can save money on the cost of healthcare and medications, and help you to understand the community health options invoice and explanation of benefits and other forms. Some of this information is applicable to other insurance providers, and some of it is very specific to community health options. But I'm absolutely open to helping to frame questions for another health insurance providers in case you need to call and have that question answered. Before we begin, are there any questions? I can write them down now and make sure that we cover them.
I think a lot of the questions that I have when I help people with the ACA get insurance, and a lot of the questions is they want to know what the difference is between an HMO and a PPO.
Okay.
So,
okay.
And I know that's
I'm gonna write that down.
Very important.
Okay. Okay. Anything else? Okay, and as we go along, if you have a question, don't be afraid to ask. So, some common terminology to get us started, and what I thought I would do is start with big picture and then get down to the nitty-gritty. So the exchange, also called the marketplace, on exchange, off exchange. What this is the Affordable Care Act and the federal marketplace where people go to sign up for an individual insurance. Some people qualify for the tax credit and some people don't. If you qualify for the tax credit, you're considered on exchange. And if you don't qualify, you're considered off exchange. So that's sometimes some terminology that you'll see in your paperwork. Open enrollment, it's changed over the past few years. It now begins on November 1st and it ends on December 31st. That's the period in which, when you have no special circumstance, that you can apply for insurance. A special enrollment period would be a situation during the course of the year It might be the birth of a child, the loss of health insurance through a job, some sort of special circumstance, which would enable you to qualify for a special enrollment period, which means that you could then go to the marketplace or use an assister to help you go to the marketplace and enroll in health insurance. There are individual plans through health insurance companies, and there are group plans through health insurance companies. They can differ, and sometimes we have to really be careful when we're talking to a group to know, or a group of people like in a setting such as this, to know who has individual plans and who has group plans. One of the big differences is that a group plan is a year-to-year basis, which can be March to March or March to April. So it's different, whereas the individual plan is now, if you sign up even in the middle of the year with a special enrollment period, it ends on December 31st, and then your new plan would begin January 1st. Or you sign up in November during open enrollment or December during open enrollment, and your plan starts in January. So that's a big part of it. Of course, with an individual plan, you're also paying for your own bill, whereas in a group plan, a part of your premium is paid by your employer. Plan design. Plan design is typically with either individuals or groups, you have a set type of plan or different types of plans that you can sign up for. They have been called by these metal levels so that you can know that when you're comparing between health insurance companies, what you're looking at. And that plan would be maybe a bronze plan, a silver plan, or a gold plan. It's important to note that a gold plan doesn't mean that it has more coverage than a silver plan or a bronze plan. It's the same coverage, but it's how you pay for it. So a gold plan might have lower out-of-pocket costs until you meet your lower deductible, but your premium is high cost. Whereas a bronze plan, it might take a while for the insurance company to start paying. You're paying out of pocket right away. So you have higher costs in the beginning and a lower premium. And that's for typically people sign up for a bronze plan who aren't using their insurance that often. There's a little bit that's changed with our new HMO product, and I'll talk about that. So this is it, how your health plan shares costs. Okay, so in this situation, I'm going to start, and typically I stand at the front of the room and I point to things, but we're on camera, we're recording this for Facebook, so I'm not going to stand at the front of the room. But you can see at the top of the screen where January 1st is on the left, and that's the beginning of the coverage period, and December 31st is at the right-hand side, and it's the end of the coverage period. And I brought these handy-dandy baskets with me today. This is the deductible co-insurance basket. This is the maximum out-of-pocket basket. And this is the copay basket. And for right now, I'm going to put them like this, but I'm going to turn them around also for you. Okay, and so when you begin your plan year, you, of course, haven't reached your deductible, but you still pay copays. So I have two baskets here, one for copay and one for deductible. So some services like primary care are often subject to a copay, and that's like a flat fee. Your deductible would be maybe $500, maybe $2,000, whatever the service is that you're having. If it's subject to the deductible and coinsurance, it means you must meet the deductible before you start paying coinsurance. Coinsurance is typically a percentage, or it is a percentage, and that's part of your plan design. The plan design is, what is my deductible? What is my copay? What is the coinsurance? What is the out-of-pocket max? That's what makes up the plan design when you have the same coverage. So if I pay a copay, these baskets, I want you to notice, are both the same size. That's because your copays are not applied to your deductible. this big basket here that says maximum out of pocket. When you pay a copay, it goes towards that money that you pay, goes towards your maximum out of pocket. When you pay a part towards your deductible, or when you finish paying your deductible and you're paying coinsurance, it also goes towards your out-of-pocket max. So everything you're paying out of pocket goes towards this limit, and this is the most you'll pay in a calendar year. Once you reach that amount, that out-of-pocket maximum for your plan, specific to your plan, then the insurance company pays 100%. So we have our friend Jane here, and I'm gonna put copay and deductible up front and out-of-pocket max over here. So we have our friend Jane, and she's paying $20 copays for probably primary care or maybe behavioral health, because there's parity between primary care and behavioral health. In other words, it costs the same to see this provider as that provider. And typically also some lower cost medications. So when you have generic medications, often they're available also for a copay. So she's paying her copays, and also possibly some other costs such as lab work or patients or other patient services, which are applied to her deductible. So she's paying the full cost out of pocket for those things, but that is being applied to her deductible. Once she reaches, so she has, if you can see here, it says she has a $2,500 deductible. And once she reaches that $2,500 deductible, her coinsurance kicks in. And in her plan, her coinsurance is 40%. So she still is paying a copay though, because even though she's met her deductible, copays still count. You still pay copays even though you've met your deductible. So what happens is you end up paying coinsurance and deductible until you reach your maximum out of pocket, which is what happens with Jane, and her maximum out of pocket is $7,150. So this is for all services that happen within the plan year. So when you have something, maybe a emergency room visit in December, and you broke a leg and you end up in the hospital, those costs unfortunately are applied to that year, that in December of that year. They do not carry over into the next year.
Will follow-up physical therapy carry over into the next year?
Yes, it will. So services that happen within a year, so that any services that happen after January 1st, even if they're related to something that happens the prior year, they are covered. Even if it's something that came from another insurance company. So let's say you were with another insurance company in December and you broke your leg, and then you choose a new insurance company in January, you are still the patient and you still have some care that you need. And so those are services that are covered by your new insurance company.
Okay.
So do you have any questions about that? Okay.
So I have a question. So all the insurance companies offering insurance in the marketplace are offering essentially the same plans.
No. So the plan design is different, and the things that are the same are the essential health benefits. So the Affordable Care Act said these are essential health benefits. There are 10 of them, and they must be covered. Those are things like maternity care, behavioral health, emergency room visits, maternal. Did I say that already? Maternity leave. So those things, there are essential health benefits that are specific. But when you're looking at plan design, you have to look at what is the coverage, and what is the copay,
Mm-hmm.
what is the maximum out of pocket? People often start with that. What's the deductible and what's the maximum out of pocket?
Mhm.
The way that you can compare plans across insurance companies is by saying, I'm going to compare a bronze plan with a bronze plan.
Okay,
Because then you're talking about similar out-of-pocket max.
okay. So the gold, silver and bronze, then is that the essential coverage that is required under the Affordable Care Act?
Yes.
Okay.
Yeah, so those have a piece in each of those plans, and you'll be able to know when you're comparing a gold plan with a gold plan that they have some very similar actuarial values basically,
Mhm.
which is what you get for the money that you pay.
Mhm.
It's fairly complex. And what many people do when they're trying to choose a plan is they say, these are the services that I think I will use in a year. This is what's important to me for services. How are those services covered by this insurance company and their gold plan or their silver plan or their bronze plan? But within community health options, we have something, our plan design is based on all of the same coverage and exceptions. And I could not answer that for other companies, but I can answer that for my company. So at Community Health Options, it's all the same coverage and exceptions across plans, but you're paying for each of those in a different way.
Gotcha, okay.
Am I sensing another question? Okay, so it's important to know your plan. And how do you know your plan? So you have plan documents. So you'll receive a member ID card, but there's also a legal document that describes the benefits of your plan, the limits, the exclusions, what's covered, how it's covered, and that's called the Member Benefit Agreement. It's an excellent document. It's a legal document. I'll talk about where you can find that in your member portal. You can ask the insurance company for that. No matter who your insurance company is, you can say, I would like to know, see what the coverage is for this plan and what the plan that I have. So knowing your plan is how you use it to save money.
Will they send you a hard copy?
They will send you a hard copy. You'll have to request it.
But it won't have your name on it.
No, it will not.
Oh, okay, I did get one.
Yep, so that's, yes. And so that's actually a schedule of benefits or a summary of benefits and coverage that you have there. I included in the handouts a summary of, let me take one here, a summary of benefits and coverage so that you could see what it looks like as a sample. And this is the plan design. So what is the overall deductible? What is the out-of-pocket max? So having your documents, oops, what happened? Did I do that? I'm sorry. Oops. Knowing what you have or knowing what your plan is key to using it the right way. And all of this information is available if you don't use a computer by calling your insurance company. And if you do use a computer, it's likely available with the other companies online. It's available online within our member portal. Because it's each plan, of course, or the plan that you purchased is specific to you in that, we want to make sure that you get the right documents. So that the right documents are uploaded into your portal, the documents or the plan that you chose and the documents for the plan that you chose.
Are employers still obliged to provide summary plan descriptions, or is that all done by the insurance company?
Employers have group administrators, and so they do have summaries of their group plans that are available. So every plan has a member benefit agreement. Every plan has a schedule of benefits. And any specific questions that you have can always be answered by member services if you can't find the information in the documents that you have. So the summary of benefits and coverage and the schedule of benefits are very brief and very common, things that are very commonly used. If you have something very specific, I encourage you to look for it in your member benefit agreement. It's the most comprehensive document that supports your insurance. And of course, your member service associate can also walk you through that. So the summary of benefits and coverage that I provided was the HMO summary of benefits and coverage. Oops, I'm skipping ahead of myself, I'm sorry. It's not going backwards. There we go. Oh, okay, so these documents allow you to see at a glance what the plan design is. But we can only give you half that picture. The other half of the picture of knowing what the cost is for the procedure that you're going to have done comes from the provider's office, right? Or the hospital. And then that's also subject to the negotiated rate that we talked about. So that's the reduced rate that we've negotiated on your behalf. And that's based on coding. And so when you do look at a procedure, the price of that procedure and that code can change from place to place depending on where you are in Maine. And there's this organization called Compare Maine, And they have this handy dandy website where you can find the cost of a procedure. They don't have all procedures there, but they have a lot of them. And they show what they cost in Bangor versus what they cost in Augusta versus what they cost in Presque Isle.
And it also includes quality outcomes as well?
It does.
Okay.
It's an excellent website. You can't break it. Go there and look around. And it's not perfect. And so when you're really doing your homework, you want to call the provider's office and you want to ask them. And often it's the business office that has the most information based on the codes you're looking for.
Is there any organization in Maine that looks at what providers are charging for a procedure and sort of critiquing what they're doing based on, like severity adjusted assessments and that sort of thing?
I don't know. Anybody in this room know the answer to that question? I know that cost comparisons have been a big deal for a long time. And it's sort of been how things have operated for a long time. And so that has been how the system has been, and I think that it's changing. And that's why Compare Maine came,
Yeah, I'll have a look. In my experience, the same procedure, severity adjusted, it would be radically different costs,
Right.
from one hospital to the other, and it's always been a mystery to me, why that.
It's the marketplace and competition, and other factors, other factors, I'm sure. But I'm not the expert on that, so Compare Maine is.
Okay.
And so, let me talk a little bit about our provider network. So Community Health Options has a broad regional network. So we work with every hospital in the state of Maine. So every hospital is in network. And one of the ways that, you save money is by staying in network. So location, while prices can change and vary by location, one of the other things that you need to look at is so it might be less expensive in Bangor, but are they in my network? And so depending on your insurance company, that's a very, pertinent question. That's one of the first questions that you want to ask. Community Health Options works with every hospital in Maine. We have also hospitals in New Hampshire and also in Eastern Massachusetts, and here's a list. This past year, and I think HMO PPO is coming up here somewhere. This past year, we developed an HMO plan, and we had not had an HMO plan before. An HMO plan at Community Health Options has no out-of-network coverage. In other words, you're in network and you're covered. You're out of network and there's no coverage, you're paying out of pocket. A PPO plan, which it stands for Preferred Provider Organization, a PPO plan has both in-network and out-of-network coverage. The out-of-network coverage has an additional deductible, and it's separate than the in-network deductible, and an additional or separate out-of-pocket max. So even though there's coverage there, it's expensive. And so in order to save money for both us and for you, because in-network means we've been able to negotiate a rate. Out-of-network means we have not been able to negotiate a rate. So we encourage everyone to stay in network, and we help people find in-network services for that reason, because it's so important. And quality is part of that. And quality, it's not just about the cost, it's also about quality. So on our website, and I have a handy dandy cheat sheet in your, it looks like this, that's in your packet, for our website. And I list down the sides the different the different tools that you can find on our website, like find a provider, and is number 1. And I put a little 1 beside where this is a screenshot of our website. So please go to our website, it's healthoptions.org, and look at the Find a Provider tool if you're looking for care, because that's certainly one of the ways that you save money. I did also include an HMO and PPO handout because that's a question that many people have. What is the difference between a PPO plan and an HMO plan? So I just mentioned the big difference is that there's no out-of-network coverage for the HMO, and there is for the PPO. But one thing you really want to know is that if you're thinking of if you need an emergency room and you're in California, and do not worry about it being out of network. Emergency coverage, even if you have an HMO plan, emergency coverage or emergency room coverage is considered in network. We want you to go to the emergency room when you need to go to the emergency room. That being said, we're going to talk a little bit later about, when do you go to the emergency room and when do you go to urgent care? Because when you're in California and you sprain your ankle, you might want to go to urgent care instead of the emergency room. If you have a compound fracture and you're bleeding, you want to go to the emergency room.
Okay.
So you would have to make those decisions based on your care, number one, and then cost, number two. So please do look at this PPO HMO. It does talk about our network, and it does have, as I spoke with before, all of our plans have the same coverage and excluded services. So whether it's an HMO plan or a PPO plan, it's generally the exact same services that are covered. It's just how it's covered. All of these materials that I'm giving you today, as well as the links that we'll see, are available on our website. Our website, again, is healthoptions.org. There's a tab that's called Individuals and Families, and under that Individual and Families tab, there are resources, and all of these things are under those resources. And if you have questions, we have an Ask a Question form on our website, so we really want to help you learn how to navigate insurance. So here we are at knowing where to go for your health care. And there is a handout called Understanding Your Medical Benefits that goes along with this slide. That's also available under the Individual and Families tab on our website. But typically, there are options for you that are zero cost. And there are options for you that are lower cost. And as you can see here, we have the zero cost and the $1 denoting the lower cost. So primary care provider is a lower cost option for seeking health care. A specialist might cost a little bit more, urgent care a little bit more, and then of course emergency room much more. One of the things that we have available to all of our members is our care management team. Our care management team can answer questions about wellness, they can answer questions about sickness, they can help you make transitions from one type of care to another type of care, let's say behavioral health care into medical or medical into behavioral health. If you have a need to go to Boston for specialty services, they have a lot of experience coordinating that type of care and can work with your providers to make that easy for you. Oftentimes, when you're not well, it's hard to do those things. So we can help you, and it's no cost. And if you have another insurance company, I would urge you to reach out to them with your questions, and they may have something similar. For health and wellness, we have through our member portal something called Healthy Options. We have a wellness assessment, and you can fill out the questions on the wellness assessment and see maybe where your strong points are and your weak points are, and work on being healthy. And we do this because we consider you part of the team, and it takes a team effort for everyone to save money and be healthy. Oh, look at that, I skipped ahead of myself again, your partner in health. So we want to be your partner, but your primary care provider is also your partner. So really they're your medical home, they're gatekeeper of your health. They should know you. When they know you, they know when something's wrong, and they can help you understand if you need to see a specialist, or they can help you better manage a chronic illness. All of those things that you can do by seeing your primary care provider regularly, even when you're well, once a year, and for your preventive services that are zero cost. All of those things help to keep healthcare costs down. They keep costs down for you, and they help keep costs down for us, because when we have members that are healthier, insurance doesn't cost as much, and we pass those savings on to our members. people people that are enrolled with Community Health Options can choose their own primary care provider for each of their family members. And we have a process of doing that either online through the member portal, or you can do that by calling us. And everyone in your family can have a different primary care provider. That's okay. If you don't choose one, we're going to choose one for you. And that makes me think of a difference between the PPO and the HMO plan. As we moved into these lower cost HMO plans, or started to develop them, we required a primary care provider for the HMO plans. Whereas for the PPO plans, we've always just suggested that it's a good idea and tried to get that across. But for the HMO plans, we've required it. And if you haven't selected one in the first 2 months of your membership with us, you will find that we've assigned one for you and we'll send you a letter. You can change that. If you don't like the person that we chose, you can change that. But that means, the responsibility is then coming back to you to do your part. Behavioral health is extremely important to everyone's full and total wellness. It's not just your physical health, but it's also, mental health and well-being. And because we, and the Affordable Care Act, it also underscores the importance of behavioral health by legislating parity between medical health and behavioral health. In other words, when you go to see a behavioral health provider and you have, let's say, a copay for your primary care that's $20, your payment to your behavioral health provider will be $20. It's parity, it's equal. So we treat these things equally. Community Health Options is invested in your behavioral health and wellness. And so what we want to provide people is that for every benefit year, your first 3 visits for behavioral health are at no cost. So of course that's in network, very important to stay in network. As you can see here, behavioral health includes substance abuse services. So very important in Maine at this time. We know that there's a lot going on and issues that need to be addressed, and we want to work with throughout the health systems to support people in their wellness. Part of behavioral health is also tobacco cessation. So we have, as it says here, we cover the cost of nicotine replacement products and or medications, even over-the-counter medications. And you can see there are some limits on that. But as you know, when you sign up for health insurance, if you're a smoker, you pay a little bit more in your premium. So it's cost savings to you to quit smoking. And we know it's hard and it takes multiple attempts, but we want to be there to support that. And the state of Maine has some excellent free services. And I think that you'll find that your health center has free services and meetings, and there's a lot of support statewide at all levels to help people quit. Preventive care versus diagnostic care. This is critically important when you're talking about saving money because we think, well, we're going to go once a year to our primary care provider and have our wellness visit. Well, if we have a complaint at that visit and we get checked for that complaint, that moves from preventive into diagnostic, because then the physician or the primary or the provider is going to look at whatever that complaint is and diagnose that complaint. So there will be a code for that. It's the CPT code again, and a charge for that. So do look at your bills when they come in, and we'll talk about how to do that. Do look at your bills. If you expected something to be no cost, call your insurance company and find out why there's a cost. They can tell you. They can say, well, if this was put in and it's not preventive, or it's not covered as preventive. That being said, the preventive services that are at 100% paid by your insurance company, no matter what your insurance company is, those are part of the essential health benefits that were legislated by the Affordable Care Act. And you can go to healthcare.gov and search for preventive services and get a list. And they're different for men, and they're different for women, and they're different whether you smoke or not. They're different if you're pregnant or if you might have hepatitis C. So it's very specific to who you are. If you're a child, they're different than if you're an adult. And so looking at the list for you is important, talking to your primary care provider to make sure that you are where you need to be with your screenings and and other preventive care. So colon cancer screening, so colorectal cancer screening is what they call it, and breast cancer screening is covered at 100% as long as there's no family history and or complaint. So if you've never had a colonoscopy and you're of the age to have a colonoscopy, which is 50, that is a service that is 100% paid for. There have been issues transitioning into the Affordable Care Act and these free screenings, and I think we've got all the bugs out, but you never know. So always look at your bill, and if you are charged for something you shouldn't be charged for, call, because that can be fixed. Any questions?
Diagnostic care, you pay,
Yes.
and that goes towards your deductible and eventually your maximum out of pocket.
So if you're at your primary care office having your preventive screening and there's something that they suggest that you need, your primary care visit will be your copay, but then the blood work that might be needed, or I'm trying to think of what else it could be. I guess it would be mostly blood work or lab tests would be subject to your deductible and then to your copay. Yes.
Okay.
And that is where there are some very specific rules around when you have a colonoscopy or when you have a mammogram. And so they have gone to actually support the patient in that if there is a finding, and that finding is, there's lab work done on that finding, I believe, and you'll have to check this please, but I believe that that's covered under your screening if it's your first time screening. So that's something to ask about and check about depending on your insurance company. But I think that was a big complaint that happened early on, and I think that has since there's been a decision. I'm not sure if that decision is specific from insurance company to insurance company, but ask. I did have an occasion to speak with someone who had a mammogram, and they insisted that she then, after they read her results and gave her results, that she go to the hospital and have an ultrasound. That's when you're taking that extra step from screening to diagnostic. That ultrasound, definitely diagnostic. They saw the results of one thing and said, oh, you need to go do this other thing. So that's where prevention and screening goes to diagnostic.
Yep, I've been through that.
Okay.
Is pre-existing conditions still?
Good question. No, yay! So that was one of the biggest things about the Affordable Care Act was that insurance companies were no longer rating on that experience. Okay, so that's a little different between group plans. Okay, so that's where individual and group varies. Is in group plans they do have past history of people, and it is experience-based rating. In individual plans, though, there is no experience-based rating. In other words, every year is a new year. It's your price that you pay is only based on your age, which we get older every year, so it's a little bit more every year. Your smoking status. So we know that that's one of the things that is called a rating band or a rating band area. And then the other one is zip code, because it costs more to get care in some places than it does in other areas. And that's competition. That's, how many doctors you have or specialists. So no longer does anyone ask you any questions when you sign up about your health care or your past health care. So here's some very specific preventative care. And as we go across, we can see that a blood pressure check, which, some of the preventive care we take for granted because it happens every time we walk into the physician's office. But that's actually part of the Affordable Care Act's essential health benefits and the preventive care that's covered at 100%. So with no history, that screening or that blood pressure check is coded as preventative, and it's at no cost to you. The insurance company pays 100%. And then here we see the diagnostic. When does that transition to diagnostic? And that is when you have risk factors or family history, or you have a specific complaint. And then the person with the history of high blood pressure gets different gets different treatment. So in other words, when you have high blood pressure, this isn't about pre-existing conditions. It's about my treatment is different. If I have this condition, then my treatment would be if I didn't. If I didn't have high blood pressure, I'd just get my check routinely. If I do have high blood pressure, I might have more visits for my blood pressure, and then I might have consultations with my physician about my condition. So there's a little bit of a nuance there. And then as you can see with the mammogram, this is screening and this is preventative, and then this is diagnostic, and you can read that.
And routine chronic care kind of is like almost the same as office visits with co-pays and all that.
It can be depending on your plan. So at Community Health Options, we do have a plan with the Chronic Illness Support Program, and I'll talk about that. And there are specific conditions that are covered under the Chronic Illness Support Program that waive the fees for your primary care visits if you have them. And so we'll talk about that in just a little bit. Got fancy here. Preventive services are part of a healthy lifestyle, and that's because they help you avoid or detect health problems. So again, the key is how can we be our healthiest selves? And by being our healthier selves, we save money. This is our care management team. This is our population health team of care managers. They are nurses, social workers, dietitians, and they provide free services. You reach them by communicating with member services and ask to be connected to one of our team members of our population health team. They may ask you a little bit about why you're calling so that they can connect you to the right person with the right training. I'm going to go backwards to say one more thing. Taking care, advocating for yourself, when you're not well is hard. And so we all need to sort of move towards that, advocating for ourselves, even when we're well and feeling good. And then letting people help us when we're not feeling good. So if you're ever out of control or feeling like you can't handle something, ask for some help, and we're happy to help because we want you to be well. So, since we're talking about money, let's talk about what happens after the doctor's visit. You get the bill, right? So I included this in full size because, or as full size as I could get it to still fit on a page. So you'll see I made an extra copy of it there. I think I put it in mine. Yeah, I did. No, I didn't. Okay. And so the things to think about, actually look how small this is. I'm gonna have to step up front to see it. Sorry about that.
Okay.
So I wanted to show you the explanation of benefits, which is at the bottom. And you see how little that is? That's not how it comes in the mail. So here's one piece of it, and it's two-sided. But it'll have 3 pieces of paper in that envelope. So we have required notices that we have to send with these explanations of benefits. So the important pieces of this explanation of benefit is the claim ID, the date of service, and the provider. Then if you go over to the right, you'll see the amount the provider billed and the allowed amount. That's the negotiated rate.
The allowed is the negotiated rate.
The allowed amount is a negotiated rate. That's the total amount that the provider is allowed to charge a Community Health Options member. So from the right of that allowed amount, then what does the plan pay? What is your responsibility? Okay, so I'm gonna come up here just because I couldn't read my bill. So what I did was I copied a part of my bill, and then I gave you the explanation of benefits for that same bill. And so what you can see is Great Falls Pathology is the provider, and so that matches. The date matches. The charge matches. So that was the amount billed on the EOB is the on this bill, the charge. And then it shows the adjustment, so it's a little, they frame it a little bit differently than we do on the EOB, But the important part is the balance at the end, and then you look at the EOB, so I'm looking at the balance and it says $75.36 for the first part. And I look down at the explanation of benefits, and under the part that says my responsibility, $75.36, it matches. And then the other piece there, and it says 200, I guess it says $263.79, I can't really see it very well. And then on the explanation of benefits, it also says $263.79. So this is very important, and the reason that that's important is because there's something called balance billing. This is in-network and a negotiated rate. Balance billing can occur if you go out of network. So let's say you do have a PPO plan and you do have out-of-network coverage. They can balance that out of that provider that does not have an agreement or a negotiated rate with us can balance bill you. They can bill you for the entire amount. So the insurance company would still pay our portion. So let's say you've met your deductible on this, your out-of-network deductible, and we get a bill. And the amount is this first amount, which is $188. Now we have a negotiated rate of $75.36 for that specific code. That's the amount that we're going to pay for that out-of-network service. It's called reasonable and customary, and we balance and we pay based on that amount. So even though it's out of network and they're charging this other amount, we may not pay that amount. That amount is subject to what's reasonable and customary. And then that provider can say, well, your insurance company paid this amount. We charge this amount and it may be higher. And they can balance bill you for that.
So in this case, now my math might not be right.
That's
on.
okay.
Reasonable and customary, you guys pay the $75.
Exactly.
And then I would have to pay $115 or something like that.
What the difference? So the difference between $75.36 and $188, maybe. Okay, so I'm not saying that every entity would balance bill you, and I'm not saying that the negotiated rate that we have for that code would be what's reasonable and customary. Maybe we got a better rate, but it would be whatever that usual and customary amount is.
So, okay, and
Okay.
I'd be responsible for the balance.
If
Like if it was more,
yes,
and especially like if it happened out of state.
and it might be somewhere where it's less.
Yeah.
You know,
that's true.
because costs are higher in Maine, and so but just know that exists. That does exist.
I've got a question.
Okay.
But it could happen to any of us except
Okay.
for Josh because he's still young.
Okay.
You go out of state and you have a heart attack, a
Mhm.
pretty bad one,
Mhm.
and you're laying in a hospital bed. I'm from Connecticut, stay in Connecticut, visiting my sister.
Okay.
And I need to stay in a hospital bed for a while. Could they ship me by ambulance up to Maine to my own hospital and it would be cheaper for the rest of my
Yes.
stay?
So
Don't do that.
what they say is, okay, so I'm out of state, something happens, I need to be hospitalized, I'm hospitalized, I have whatever procedure I'm having that I have to have right away.
Yeah.
I'm stable. Once I'm stable, time to transfer to an in-network hospital.
Okay.
Because the cost of that transportation is going to be so much less than if you stayed in that out-of-network
Yes.
facility.
Yeah.
And that's a situation where you would wanna work with the it's not a social worker, but there's typically a patient representative
Yeah.
that's employed by a hospital.
Mhm.
You wanna work with them, you wanna give the okay for them to work with our care managers and let them figure out what that is so that you laying in
Yeah.
the hospital don't have to worry about that.
Okay, like Brandis over in Machias.
Yes.
She's the one, and there's another one too. that's on
Right,
at
so
night.
working with the people at your disposal is important, but then what's most important is that you get to make the decision. So they don't make the decision for you, but what they do is they say, okay, we've talked about it, we've shared all this information, and this is what your options are. And then they help you, you get to make that choice. But it's an informed choice.
Yeah.
Okay, any more questions about the invoice? And I apologize, it's so small. I was trying to fit it on the screen. But again, you can see across the explanation of benefits, which I love this document because it is simple. It could be, a little more specific here and there, but as you go across to the right, after we talk about your responsibility, then it shows co-pay, co-insurance, deductible. And as you can see, I had not met my deductible yet, so that was my responsibility. And so that $75.36, and again, that $263.79 went towards my deductible. And these, every single one of these, as well as your claims, are all in the member portal. You can look at them at any time. If you don't use a computer, you can call us and we can mail you copies if you didn't get a copy for some reason or you lost it or.
Yeah.
I know everybody gets a lot of mail, and it's important to look at your mail and know what it is before you file it. Okay, so since we're talking about money, let's see. We all know that prescriptions are a huge part of what we pay for. So understanding what drugs are covered, how they're covered, and when that changes is really important. Our formulary changes twice a year. It changes on January 1st for the new year, and it changes, and we have that available early so that when you're choosing an insurance company, you can look your drugs up while you're shopping, and you can see where they're covered and how they might be covered under your plan. And then it changes again mid-year, July 1st. And so when we do that to save money. And so what we do is we review the formulary, and we might see that there are some high cost drugs that no one's using, and we maybe shuffle them off to the side. Or there's a new generic and we bring in the new generic, and then that means we might raise the tier on the old name brand so that people will use the generic. So it's all done to save money for you and for us. And you'll get a letter. So if you're a Community Health Options member on a certain medication and that there's a change to that medication's tier or cost, and whether it's lower or higher, you'll get a letter about the what and the why. And you'll have an opportunity to give feedback on that. There's also an opportunity, so let's say you've tried all of these generic medications and you have this name brand medication that you take and you have to take it. Your provider is your partner in keeping that drug available to you or that medication available to you. So you work with your provider to provide the necessary information around that. Now, that being said, I'm going to go to the next one. I think this is the one. There are, when we are talking about non-generic medications, either name brand or specialty medications or compounded medications, it can be very big money. And we have found that the way to save money is by going through a very specific online specialty pharmacy. And that it's the way to keep the costs down. And so that means home delivery. And we do, as I'll talk about later with chronic illness support, home delivery is a big part of that as well. It's the way that we keep costs down. I know it's a little bit of an inconvenience, especially when you're transitioning from year to year, but there's a lot of support through Express Scripts, and they are our pharmacy. And then we also have another sort of cost savings plan, but Express Scripts works, they have a 24-hour-a-day call center, and they will take calls 24 hours a day.
Now, I might use that, like if I need a thyroid maintenance drug.
Mm-hmm.
My husband, on the other hand, takes a statin just every other day. He doesn't need it that much, and he wants to support the local pharmacy business. So he could just call his primary care physician and say, can I?
And that's your choice, and I understand
Yeah,
shopping local, I get that.
Not that we wanna throw our money around, but
Right.
Help out a little bit.
Yep, nope, I totally understand, and this, we're always thinking big picture.
Yeah,
And so,
like, I'm sure if I got on thyroid, I want it delivered to the house. And,
So we have to think big picture, and so we are to try to
Yeah.
streamline things, and that's really why we use our website so much and our member portal so much, is it's to keep costs down, because we're a nonprofit, and so 80% of the money that we take in premiums goes back into benefits, and 20% goes towards administration.
Like when I was a teacher, I got medicine through the mail.
Yep.
They had a plan in addition to the teacher's insurance, and that really helped.
And sometimes the hardest part is just getting it going.
Mhm.
And people, as people use computers more and actually even their phones more, things I think are getting a little easier. But it's a transition. So understanding the formulary is really important. So in this cheat sheet of our website, the screenshot of our website, you'll see that the formulary is number 4. So if you look at the little highlighted button down at the bottom, number 4. So we have this on our website, quick links. And you click on the quick links over to the right-hand side and it drops down this menu with all of these handy-dandy things on it. So the formulary is there for you to look at. It's there for you to look at in November when you're shopping for a plan and you want to look at the medications that you take. It's there for you every time of the year. It's there for people who aren't members, and it's there for people who are members. It's huge. It's probably 200 pages, and so it's hard to navigate. You use with a Windows computer, Control F, and you type in exactly the name that's on your little bottle or on your slip, because it'll find it, and that's how you have to sort of read the chart. There are lots of acronyms, so I've called out a few of the acronyms here for understanding. Step therapy is something that a lot of people haven't understood, and that is if you are prescribed a specialty medication and it's very expensive, sometimes we will ask that you try these other medications first. Your provider may say you already have, and they may provide documentation of that and how that worked for you, and maybe it didn't, and then you stay with the medication that requires that step therapy. But if you haven't tried these other medications, there's a process for specific drugs that you must go through this step therapy in order to try these before you go to the most expensive drug. Over the counter, OTC, prior approval. So in your plan design, and again at Community Health Options, all the plans have the same coverage and exclusions, and they have the same formulary. A little side note, if it's a group plan, it might have a different year plan than the plan that you're on. This plan for individuals this year, the formulary is the 2018 formulary.
Okay, so some over-the-counter supplements, like fiber therapy,
Right.
that may be covered, I'll check the.
I don't think so. It would have to be a prescribed medication for you and with a name. So this is often, it could be nicotine, some sort of nicotine lozenge or something like that, possibly. I'm not a nurse, so I can't really say, but what you'll see when you look up your medications or your fiber therapy, whatever the name of it is, you can look it up and see, but it would need to be prescribed to you.
The doctor did send me a letter and told me to take this certain kind.
Okay.
So I could probably.
Okay, it's something to check out.
To check into.
And especially look at not the name brand of it, but the generic name of it. And see if that's
right
on
on
it.
the bottle, the generic name.
Exactly.
Sure.
So, and then you'll see here, there's a QL, and that means quantity limit. That doesn't mean over time we will only cover this much. It means within a period of time.
Yeah, within a year.
And so, and of course, with the opioid situation here in Maine, there are some new rules around that.
Yeah.
But
Yeah.
very much medications and care, you're a partner with your primary care, or you're a partner with your specialist if it's a specialist that's prescribing you, or your behavioral health professional. So they advocate on your behalf for medications if you have an issue with us, that let them help you work with us on that. Chronic illness support. So you'll see this CISP on our formulary. So we have in many of our plans, or in some of our plans, I should say, we have this chronic illness support program. It covers people with asthma, diabetes, hypertension, emphysema, COPD, coronary artery disease. I got them all. And so when you have a chronic illness, there are very specific, routine doctor's appointments that you go to. There are very specific tests that you have every year. So what we do with our chronic illness support program, and more information on this is available on our website under the individuals and families tab and resources. What we do is we lower costs for things like your primary care visit would be zero cost. Your tier 1 drugs would be zero cost. So what you see here is there would be designations for CISP or CISP1 that would be the either zero cost share for tier 1 medications or a 50% reduction in cost in tier 2 or tier 3. And just so you know, when you're reducing that cost share, we waive the deductible for that. In other words, it's not that you don't ever have to pay your deductible, but you can access that medication pre-deductible. In other words, you don't have to meet your deductible before you can have 50% off that medication and pick it up at the pharmacy. Because if you have a chronic illness, we want you to take the amount of medication that you're prescribed on a timely basis as needed and to get the right care. And all of this leads to affordability, is getting the right care at the right time and taking care of yourself in the right place. And hopefully that means your primary care is where you start. So this is, there is a link here about searching the formulary and hitting Control F. We put that in here so that, because it is very complex. The other piece is there's a lot of explanation at the beginning of the formulary. If you have any questions, it's a really good piece to read. It talks about the abbreviations, but it also talks about a little bit about the methodology, why we do what we do. Lower costs. So our RX Savings Solutions is an add-on. So we have a pharmacy benefit manager. So that's Express Scripts. So you'll see everything that you do online with us with medications is an Express Scripts related, whether it's the specialty pharmacy, also known as a Credo, or whether it's your mail order medications or your CISP medications through Express Scripts. There's an additional opportunity, and there's a flyer in the very back of your packet that talks more about RX Savings Solutions. It's an add-on program. You have to sign up for it if you want it. And they text you or email you when things happen. And so in the pharmacy, in the pharmacy world, things happen. Generic medications happen. Prices change. They, have these big web crawlers, and they know what medications you take when you sign up, and they send you alerts. And they can send you an alert if your local pharmacy has a sale on whatever it is that you take. They'll text you and let you know. So it's up to you. And as you know, sometimes when you get texts, you have to pay for them. So, don't sign up if you have that type of phone and you don't want to pay. But do sign up, and you can sign up with email only if you like, if you'd rather not receive the text and you'd like to receive an email. People have saved a lot of money using this add-on. Okay, so reading your invoice. We've gone through a few incarnations of our invoice, trying to make it easier to read. We generally start creating the invoices on the 10th of the month, and they're typically begin to be mailed the 11th through the 13th. So we send out a lot, so it's sort of a process, and we do a little quality control in the beginning. And so by the 13th, we typically have them in the mail unless something happens. So every month we get data from the marketplace, and that data is typically your tax credit, or these people no longer have plans with you. These are termination files, or here's your new people. So we're constantly in flux with new people coming in, people leaving, and possibly even tax credits changing or going away. And so all of that information is compiled into your invoice and generated here. And so what you will see is the total amount that's due, less your subsidy, less any adjustments. And this is a very simple one, okay? So I gave you, this is a simple example. What makes it difficult is if something changes or you've made a partial payment. So sometimes what I find is that people who've been members with us for a while, and so they are transitioning from December to January, and they didn't actively re-enroll, they just let it happen, and they're in the same plan, and they expect that nothing's going to change, that it's all going to be the same, and it doesn't work that way. Because your plan will be more expensive because you're older, and your tax credit will change based on your income. So, and also, so I'm sorry, I take that back. Your tax credit will remain if you did nothing. They'll use the same income to generate your tax credit, but the tax credit might be more because the cost of the plans are more in that year. So from 2017 to 2018, the way that they determine how much the tax credit is based on I think the second lowest cost silver plan that's available in your state. So when you take the cost of the second lowest cost silver plan in 2017 to 2018, it's going to be more money because the prices have gone up every year so far, right? And so the tax credit is more. And so you're paying the same amount you've always paid, but it's different than we've calculated. So that's when it gets difficult. So that's when you need to look at the adjustments. Or the prior balance. So this is about what you pay. That would be the prior balance. The adjustment would be, here's something that's been done to your subsidy, or your subsidy has changed. So this is how much the subsidy is. But that middle area is, here is the total premium that's charged. And oftentimes people don't see that total premium. They see, this is the amount that I owe, and maybe they're paying online.
And I usually re-enroll in December 1st for January 1st.
And you update your income information and your family information?
Yeah, I update my income information to the best of my knowledge, but the most accurate figures will be after the income taxes.
Right, of course. And in a situation like that, now is a great time to look at that. To say, okay, I'm gonna go back into my file and look at what income that I estimated for 2018, and where am I?
Yeah.
Mid-year.
Yeah. Okay.
And reevaluate, because you can go to the marketplace and update your account, and it'll adjust. It'll show under adjustments, and it'll adjust your tax credit if it up or down, depending on what you find out, or you might choose to leave it the same and reconcile at the end of the year.
Great.
But just know that is an option. One of the things that we see, that important messages piece, so I know a lot of people don't, like my daughter, she doesn't even open the invoice. She just pays it online. She knows what she's supposed to pay, and she just pays it online. She doesn't even open the invoice. I'm like, but you're missing out on the important news. So we put important information in that message box. We might also use the back pages of the invoice to tell you about member orientation events that we're having every year. We also put that information on the front page of our website. We put it on our Facebook page. We try to communicate with people in any way that we can, but the invoice is part of it. If you have questions about your invoice, if you think there's a mistake, you can call us. Oftentimes, we have to wait for the marketplace information to update anything. We can't just go into your account and update it. And the reason that we can't do that is because your information has to match. So the information in our file, and then we get this data influx from the marketplace, it has to match in order to update your record. So we can't make any changes until we go through the marketplace process. But that being said, if you think there's a mistake and you call us, we'll say, well, we think this is the problem and you need to call the marketplace, and here's their phone number. And if you can't get anywhere, that's when you call someone like me. And what I do is try to facilitate a three-way call between us and the marketplace and you, so that we can all be on the same page.
Yeah, I've been through those too.
Yeah, it
I
happens.
think they're getting better.
It happens.
Yeah.
It happens. But the goal is, not to, the goal is we want everybody to feel like that, we solved it, that we came to a place where we all agree this is the answer. So payment options. we have, this is a little link to an auto pay tutorial. On the back of the cheat sheet with the screenshot, I put all the very long drawn out URLs for each of these because I could not provide you with a live link. But I do want you to know that the tutorials around auto pay, using the member portal or setting up the auto pay. And just a note that if you set up the auto pay, you can do that so that it pays every month on the same day for the year, or you can make an individual, just a single payment each time if you want. So you don't have to necessarily, sign up for the whole year of payments. You can make a month by month payment if you like.
Now I got kind of a bold question.
Okay,
The wellness assessment tutorial number 10.
Yes. yes.
What if it looks like you have been as happy as you should? Are they gonna use it against you?
What if it, oh, no.
Okay.
So before you showed up, we had a little discussion about pre-existing conditions.
Yeah.
We don't use your wellness against you. No, it's actually, it's your information for you.
Okay.
So you can say, oh, look, I'm eating well, I'm doing the
Yeah.
right thing, but I'm not moving enough.
Yeah.
So what do I need to focus on? I need to focus on moving more.
Yeah.
I think I'm talking about myself.
No, I understand that. My candy bar on the way home from work.
Yep.
In the car every night. Yeah.
So these tools and I want you to know we're not tracking you via our website. We're not tracking you and saving all your answers. I just want you to know that these are just tools to help you, one, be comfortable navigating our website so that you'll go back more often and find out new information and self-serve.
Well, when I was with another company, I tried to get on the the portal.
Mhm.
And it didn't work. And then I went to J.G. Rossborough and they tried to get me enrolled. And it didn't work, or it was something about a password, too many. So can I start fresh and try to get myself on the portal?
Have you had one with us before? You don't remember?
Community Health Options.
So
This year has been good.
You can
okay?
call us. You
Things
can-
are, okay.
yeah. Why don't you call and ask?
Because things are going
Yeah.
good this year, but
Yeah.
2 years ago, January, February, March, I paid premiums each month. And then went to the doctors, cause I figured, I've got insurance, and then Community Health Options says, no, maybe it's community partnership, something with community in the name.
Okay.
Says, no, you're not insured, and yes, I am,
Ah.
I paid the premiums,
Yeah.
and I went to the doctors. And they ended up sending me the premiums back, but the doctor bills was more than the premium, I'm like, oh man, it wasn't that urgent, I could have stayed home, why
Right.
did you go to the, but so you guys have been good, but if I'm on the portal, I
Right.
kinda know.
As far as I know, you can go, it wouldn't hurt to try, so go in and act like, this is my first time and create an account, it'll tell you whether
Okay.
you have an account or not.
And I'll go through this
Yep.
to create an account.
And if there's, and there is, follow the look at the member tutorial first.
Mhm.
And it's a little slide show, so,
Oh, okay.
Yep.
Yeah,
Um,
I'll try, and then if it doesn't work,
okay.
I'll call you, but I
absolutely.
don't have any complaints, but a few years ago, it took a while to get things rolling.
Okay, so multiple ways, I'm gonna try to wrap this up, multiple ways to pay and commonly used forms. So PHI form, if you want to share your information, if you want somebody to be able to call us on your behalf, you need to fill out this form for them. This form is available on our website, Documents and Forms, I've noted where that is. The explanation of benefits, we've talked about, medical reimbursement form, you've paid for something out of pocket and you want to get reimbursed for it. That might be something that was out of network if you have a PPO plan, or what would be another situation where that happened? I don't know, you didn't have your card yet in the calendar year and you paid out of pocket for primary care and now you want to get reimbursed. We have forms and they're on our Documents and Forms. Same thing with Express Scripts prescription reimbursement form. If you want to change something about your policy and you are on the exchange, you change it there at the marketplace. You edit your account at the marketplace. If you're off exchange, in other words, you don't get the tax credit, then you can use our cancel or change policy form. The individual enrollment or change form, same thing. You can add people if you're off exchange. If you're on exchange, you get a tax credit, you must do all of that at the marketplace, and they send us the data.
Okay, so your portal is different than the exchange portal.
Exactly.
Oh.
We're an insurance company and they are the federal government, healthcare.gov.
I got you,
Yep,
yeah. Okay.
exactly.
Yeah,
Hmm.
yeah.
And then there's an appeals form. So you had, you paid your premium for 3 months and you went to the doctors and they said you didn't have insurance. And the company, whatever the company was that sent your money back, you can appeal that. You could have appealed that at that time. You know what? I've paid this. I signed up.
Yeah,
What's happening here? I got bills. Or you've told me that I can't have this medical this surgery that I think I need and that my doctor thinks I need, it's been denied. Why? And what do I need to do to make it happen? There's an appeals form and there's an appeals process. So always use your primary care or your specialist or your provider, a healthcare provider, as your partner in your process, because they are your best advocate. It's a team. We're not here to deny you. We're here to make sure you get the care that you need.
yeah.
And if we said no, it's probably because we don't see that there's a reason for the care that you need, and we need somebody to give that to us.
Mhm.
Important numbers, you have these in your slides or in your printout. Note over here under behavioral health, the telephone that's available 24/7 is a crisis line. We are open 8 to 6 Monday through Friday. If you look, so there have been situations where we've needed to reach somebody on a weekend. People monitor, typically people who are in that situation have a care manager that they're working with, and so they email them and that process happens. I have been messaged on Facebook by someone who needed to get a hold of a care manager. Things like that happen, and we do our best to accommodate. So people are looking at their emails if they have a position of responsibility. But Monday through Friday, regular business. Your portal, I can't push it enough, so thank you for saying you're gonna sign up for it. The more that we can help our people to self-serve, the more that we can save money. You can, know better how to use the tools that are available at your disposal, and we can all save money. And here it is, you can pay your bill online, you can assign your primary care, you can set up bill pay, you can view your claims and benefits.
The bill paid to the company, but not to the hospital.
Right,
Yeah.
exactly.
Yeah.
Exactly. And the wellness assessment, not being held against you, but only for your own use.
Yeah,
And you can
okay.
print it out and you
That's
can take it to your primary care provider and say,
Yeah.
hey, look at this, this is
Yeah.
what I wanna work on.
good. Yeah.
Yeah.
Okay.
So putting it all together means really understanding and advocating for yourself. If you have questions and asking those questions, looking at your member documents and knowing what your plan is, and thinking about when you're choosing a plan, thinking about what do you need for care, what medications you take, what you can afford to pay. Because if you can't afford to pay for your premium, then your insurance lapses, then we all lose. You're not getting the care that you need, and we're not helping you by keeping you as a member. Any questions? Okay, and so we talked about HMO and PPO, and we talked about the plan year. So services in a plan year, January 1st, beginning January 1st, every year, it's like a reset of your deductible, even if you've been a member with us for 3 years.
Is
Thank you.
December 1st too late to do this?
To do what?
To re-enroll?
Nope,
December
it ends December 15th, so November 1st through
No.
December 15th.
November 1st.
Yep, through December 15th. And that's for plans that are effective January 1st. It's a short time frame.
Yeah, I think actually I always do it in November, but
That's good.
now
That's good.
I'll call and get a copy of my member benefit agreement.
Okay, and if you need help from an assister, then you should call them up and make an appointment with them to sit down.
Yes, and I'm able to do that for you, so if you ever need any help, let me know.
Thank you, Josh,
You're
yeah,
welcome.
I think,
And the
Oh,
marketplace sometimes gets busy, the healthcare.gov website gets
yeah.
busy, especially at the end. It's open 24 hours a day, although this last year they closed at like midnight on Saturday, right?
I think so.
Yeah.
It was the last day they had so many incoming calls that they were reaching out to people the following day, so.
Well, I had always said to people, you know, take a nap, get up in the middle of the night and do it when no one else is on there.
It's usually the first 3 days and the last 3 days that are
Mhm.
the worst to get on.
All right, so I manage our social media. So if you have any questions, you can message me through our Facebook page and I'll get back to you. And I will post your question and answer if it's applicable. I try to make everything a teaching moment.
Thank you, Karen.
Thank you.
Yes,
Thanks for
thank you
coming.
very much.
Thank you
Thank
for
you.
coming.
Wonderful, thank
Thanks
you.
for having me over here.
We appreciate it.